about the different ways in which we try to predict ovulation. Ovulation usually occurs spontaneously and is the first step of a possible successful pregnancy. Couples desirous of fertility will want to plan sexual activity to time with ovulation. This is true for couples on fertility treatment or those trying for spontaneous conception. Conversely, a couple who wants to avoid pregnancy will also want to avoid sexual activity at this time. The menstrual cycle is defined as the days from the start of a menstrual flow to the subsequent flow and is usually 28 days with a standard deviation of 7 days. What is the ovulatory process? A woman with an intact and normal hypothalamic pituitary axis with normal ovaries will produce an increased amount of FSH, stimulating the ovaries to start the production of ovarian follicles. The ovary will begin developing 8 to 15 follicles of 3 to 7 millimeters each at the start of a menstrual cycle in a normal situation. As these follicles grow, the estrogen levels increase, sending a negative feedback to the pituitary, hypothalamus, and inhibin, leading to decreased FSH levels. A dominant follicle is usually selected and the remaining are then allowed to undergo atresia. The dominant follicle continues to secrete estrogens that continue to reduce FSH levels further, and persistently high estrogen levels would release luteinizing hormone levels, triggering ovulation. After ovulation, the dominant follicle converts into a corpus luteum, which secretes estrogen and progesterone, and then finally collapses in the absence of conception with the resulting initiation of menstruation. How can we predict ovulation? Ovulation usually occurs around the 12th to the 14th day of the menstrual cycle in a regularly menstruating woman with intact ovulatory systems. When can we not predict ovulation? If a woman has a delayed cycle or a very short menstrual cycle, then some tests will only allow prediction of ovulation. Similarly, if a woman is pubertal or perimenopausal or has a functional or a physical disorder affecting the menstrual process, then a prediction cannot be made according to dates. The woman can check her ovulation status with methods in different scenarios. In the first scenario, the couple is under treatment and is using ultrasound. In other scenarios, the couple may be trying for conception without medication and be using very simple methods which are based on physiological changes or point of care testing. If a patient takes medication to induce ovulation, serial ultrasound examinations are a reliable method for making assumptions. It will recognize the development of a dominant follicle and its collapse, indicating ovulation. An experienced radiographer and a good ultrasound machine are required to get the correct images. However, the method is invasive if done transvaginally, expensive, and may be inconvenient. How do we know by ultrasound that ovulation has taken place? We can see the size of the dominant follicle and then its sudden decrease. Evidence of corpus luteum formation by the presence of echogenicity inside the follicle, presence of free fluid in the pouch of Douglas, and the presence of homogeneous hyperechoic, luteinized endometrium instead of the triple line appearance. When ultrasound is used to detect ovulation, it is evaluating the presence of a dominant follicle in the ovary with a size of 22 millimeters at the right time. There are some requirements for ensuring that this is the follicle where ovulation is predicted. Firstly, this size of follicle should not be present at the beginning of the menstrual cycle. Secondly, the follicle should be seen to be growing slowly. Thirdly, after reaching the optimum size, the follicle would then change size and undergo a change into corpus luteum. Optimally, the endometrium is also thickened with a 10 millimeter thickness at the time of predicted ovulation, and this change is more likely to lead to a successful pregnancy. There are some methods which patients can use themselves even if they are not having active treatment. The calendar method depends on the couple keeping a record of the menstrual dates every month. It is the simplest method if the menstrual cycle is regular, and usually ovulation time will be between 12th and 18th day. Couples are encouraged to have intercourse between 2 to 3 times during this time period. If sperm is alive for up to 4 to 5 days in the female genital tract and the ovum survives for 12 to 24 hours, then this time period and frequency should be able to result in conception. When a couple is having ovulation induction treatment, they should continue to use the calendar method for intercourse, especially when either spouse is traveling. The second method depends upon the cervical mucus, whose appearance and characteristic changes occur with the different phases of the menstrual cycle. Under the influence of estrogens, the water content of the mucus increases and the protein content decreases. The secretion looks like that of a white of a raw egg. Once ovulation has taken place, the secretions change and slowly become thick. Even though the method is inexpensive and directly under the woman's control, it is not very popular. Various reasons include difficulty in obtaining the cervical fluid and the presence of infection, which may make decision making difficult. Under suitable conditions, the method is reliable and sensitive between 75 to 95%. Changes in body temperature can also predict ovulation. There is an increase in body temperature in response to the rise in progesterone from the corpus luteum. Traditionally, this method uses an ordinary thermometer placed under the armpit for 1 minute and charted on a graph. An increase of 1 degree Fahrenheit will occur with increasing progesterone levels. Used in combination with urinary LH detection, it is a highly reliable method. Point of care testing at home is also a very good alternative for couples. Many point of care and over-the-counter ovulation detection devices are available commercially. These combine physiological changes associated with ovulation, and they have combined with technology to allow couples to easily detect ovulation within the privacy of their homes. Some websites which explain these point of care devices is given in the description box below. The script of this video is also in the description box below. Please like, subscribe, share and comment, Press the bell icon to be identified about the videos as they come. And thanks for watching. Goodbye.